Hello my dear subscriber and viewers, welcome back to Akshara Akshita 2023 channel. In this video, I am going to explain about coding guidelines for Radiology part 2, that means ultrasound guidance. So in last video, I already posted part 1, this is part 2 video. So those who are not subscribed my channel, please subscribe my channel, press the bell button, select all, then only you will get my future videos as a notifications. Okay, before going to the guidelines, first we will see the some terms and definitions. So what is the ultrasound? So the ultrasound definition is the use of high frequency sound waves to view internal organs to diagnose the particular conditions. This is called as ultrasound. So okay, in this ultrasound we have some different set of codes based on the whether code is B scan, A or M mode or real time or completed limited. So based on this only we have to select finally one CPT code. So the definition of A scan, B scan, D scan in our book itself they have provided. So based on this mode or type of the scan only we have to choose the CPT code. So A means one dimensional ultrasound measurement, M means one dimensional ultrasound measurement with movement, and B means two dimensional ultrasonic scanning with two dimensional. And what is that real time means? Real timing is a two dimensional ultrasound scanning with the display of the display on the monitor what they are performing inside of the service room, what they are performing, that same image will display on the monitor, so with the timing. So this is the real time scan. So chest, head, these related extremities internally they are performing ultrasound means this will be based on the type of the scan, whether it is A, B, M or real time. But if it is abdominal pelvic ultrasound or extremities mean we have to check whether it is completed or limited. So that what is the when we can consider this procedure is a completed, when we can consider this code as a limited means in our CPT description itself they might have mentioned the what are the internal organs covered under the completed. So in that under that code paragraph itself they mentions these are the organs which we can consider the complete. If one of that organ is missing to visualize the doctor means then we have to consider that as a limited only. So if it is completed means what are the organs they have mentioned in that paragraph or in that CPT code descriptions, though everything if doctor is visualization done then we can consider as completed. If any one is missing from that list means we have to consider as a limited. Okay, this is for chest and ultrasound abdomen or pelvic. This later part in internally we have multiple organs. So when we so that's why they have given the two types of code, either it is completed or limited. Okay, then next part will be ultrasound abdomen, either the pregnant or non-pregnant. So if it is pregnant means we have to check what is the trimester of the pregnant, then which gestation, what gestation, either it is single gestation or twin. So based on this only we have to choose the CPT code for all. So first we need to check whether the patient is pregnant patient or non-pregnant patient. If it is pregnant patient mean then furtherly we have to check patient's trimester or patient weeks. So younger than 14 weeks means 76801, 76802. Okay, then older than 14 weeks means 76805, 76810, 76810. So each trimester, why we have two set of codes? One code is for first gestation. Then if each additional gestation means add-on code, we have to code it separately. If it is twin baby means, then 76801 one time and 7680 add-on code will be second. So based on the number of the gestations, add-on code we have to code additionally. Okay, then next is approach we have to check. So whether the ultrasound will be through transvaginal or transabdominal approach. Okay, so maximum codes we have transabdominal approach, and transvaginal approach we have only one code. So the first time we have to check patient's gestation, then weeks of the gestation, then first gestation or single or a number of the gestation, then trimester, and next is the patient's approach. So which approach doctors are doing this procedure, transvaginal or transabdominal approach. So based on this only we have to select the code. Okay, then 76816 also ultrasound code only, but this code is for re-evaluation code. So patient already done ultrasound, but due to some reasons patient is coming again to evaluate the fetus, means the second time we have to give 76816 one time. If it is multiple gestation, for re-evaluation we don't have add-on code, we have only one code. If it is multiple gestation, patient is coming for re-evaluation of the ultrasound, then 76816 two times we have to bill with 59 modifier. So if it is first time evaluation, 76805, whatever the trimester, whatever the gestation, add-on code we have to go. If it is re-evaluation, only one code available, 76816. So if it is multiple gestation, then multiple times we can give same code with 59 modifier. Okay, 76817 is for transvaginal approach of code. So transvaginal approach we have only one code, 76817. Okay, so abdominal approach only we have many code sets. So in that code sets only we have to check the trimester and what is the gestation, single or multiple gestations. Okay, next let's see non-obstetrical pregnancy codes. So 76856 is for complete evaluation of female pelvic anatomy. Okay, here also we have re-evaluation code, 76857 code we have. So if it is 76857, re-evaluation of one or more pelvic abnormalities are previously demonstrated on the ultrasound. So we need to code 76857 for re-evaluations. Okay, 76857 rather than 76770 should be utilized if the urinary bladder alone. If only urinary bladder, 76770. Okay, if not including kidney, if it is including kidney, then we have to code the normal level ultrasound code. Okay, here also we have transvaginal approach and abdominal approach. So we have to choose the we have to check the questions, what is the type of the approach doctor is performing. Okay, so in abdomen sides, extremities sides, we have two set of codes, completed and limited. So as I said you, completed we have to check in our book only, that paragraph itself they have mentioned what are the organs, what are the sites that's included to consider as a complete. If it is any one is missing, then we need to consider it is as a limited. Likewise we have extremities ultrasound also. As of now we have saying the abdomen related, obstructive, non-obstructive, chest, head related we have done. So now we are checking the extremity related ultrasound. So extremity related ultrasound also we have two set of codes. So one is 76881, 76882. 881 is completed, 882 is limited. Okay, so in here also they have mentioned in CPT code description itself what are the sites is included as a completed and limited. Okay, and more here also real time with imaging documentation and normal code we have. So the meaning of real time I already explained. So what are the if doctor is performing ultrasound with the display on the monitor with the timing means, then we need to consider that procedure service is a real time basis. Okay, so in ultrasound, in next topic is ultrasound guidance procedures. So what is the guidance? So to guide, to visualize the organs, doctor may use the ultrasound. So when this procedure doctor may perform? So doctor will perform this procedure when doctor is doing other any major procedure or any minor procedure. During that procedure, doctor may use ultrasound to uh, to evaluate, to visualize the more clear on that particular site. Doctor may use the guidance as a ultrasound. So this ultrasound as a guidance doctor may use. If doctor is using ultrasound as a guidance during some other procedures, then that other procedure we have to code first, followed by ultrasound code. But we need to check the main procedure concept. If it is main procedure concept, CPT code description itself says that including of ultrasound guidance CPT codes, then we do not code ultrasound guidance separately. We have to code only the main procedure. If suppose we don't have any guidelines to the particular major service or minor CPT procedures, then we have to code that code as a primary, then ultrasound guidance code as a secondary. So ultrasound guidance code start from 76932, 76937, 76936 and so on. Okay, so keep it in mind whenever any other procedures during that time doctor may use the ultrasound as a guidance. So that time we have to use this code, but still we need to check the main procedure description and the note. So if they didn't add anything about ultrasound do not code note means, then we can code additionally ultrasound guidance. Okay, so ultrasound guidance guidelines is finished. If you have any doubt, please comment below comment box. And if you like this video, please like and share to your friends also. Then only my effectiveness, my effortness will reach to many people. So those who are like my videos or those who are wants to grow my channel, please don't forget to like and comment. So each video, whatever videos you are watching, please, if you like that video, please like and comment, then only that video will reach to many people. Okay, then I would like to share about one day course. So one day course means so already those who are joined to an institute while studying, you can feel in our institute they will not teach clearly, and see ICD you are thorough about, but ICPT you have doubt. So CPT separate course also available and one day course available. So this one day course, those who are joined in one institute, they are preparing for the CPC exam, or you completed CPC exam but still you are not confident, you are still you are like you are not be very much confident to attend the exam. You have less time, so you are practicing some particular questions within that time, but you are spending more times on most of the questions. You are not getting you are not managing your times while taking your questions. So for those people, so I'm taking one day course. So in this one day course, it covers all your doubt clarifications, then important coding guidelines, but then important repeated questions discussion, So these repeated questions I collected from those who already attended the CPC exams, cleared. So from those people I collected the all repeated questions. Same questions only this full year and next year also they are asking. So same questions only still past 4 years I am seeing same questions, same topics only they are asking the questions. So those materials is very important to clear your exams. So that part I will discuss on the one day course. Then important tips and tricks, these important tips and tricks very important, because in this section only I will explain you very shortly how to solve these questions within 2 minutes. How much paragraph you have, a 6 pages, 6 lines, 7 lines, 8 lines, 1 page. So case study and all they will give 1 page questions, then only options. So whatever page, whatever size, questions of size you are getting, you can solve within 2 minutes. So I will explain you how to eliminate the wrong answers. So based on the question, based on the option itself, we can eliminate the first wrong options. So this in this sections I will explain clearly. I will explain you to save your time. So this is very important part in the CPC exam. So most of the candidate will not complete our all questions within the times, but my student everyone will complete before 15 minutes, before 10 minutes itself. So if you follow practicing the questions based on my tips, definitely you can save your time, and maximum answers how we can take from the book shortly. Everything I will explain you in this sections. Okay, this is one day course. Those who are interested, please join. Please comment to my email so that I can share you the price of this one day course section. Then and if you like this video, please share and don't forget to subscribe my channel. Thank you for watching my video, guys. Thank you.